Perfect. So I just want to thank our partners for today's info session. So we have our great speakers from King County, and then we, the Seattle Metro Chamber, worked with the Seattle Southside Chamber, One East Side Spark, and Business Health Trust to get the information for this webinar out to as many people and businesses in our community as we could. So thank you to our partners. We have almost 300 people on today's webinar, and I'm sure more will trickle in as we get started. So I'm really excited for all of you to be able to hear today's content. So with that, I welcome Andrea Ray, President and CEO of the Seattle Southside Chamber, who's going to lead us through the rest of the program. Thanks, Andrea.
Thank you, Lee. Really appreciate it. First, I hope everyone is healthy and safe and doing what they need to do to stay that way. As a nonprofit business organization in business for your business, we are doing all we can to support you through this and every challenge, and are so grateful for our partnership with Seattle Metro Chamber, One Eastside Spark, and Business Health Trust. We were founded on the belief that we are better and stronger together, and really appreciate our regional collaboration. Today, we're going to learn more about the requirements for the vaccine verification program, which businesses are impacted, and how the program will be enforced, and of course, answer your questions. To walk us through all of that, please welcome our speakers, Shannon Braddock, Deputy Chief of Staff for the King County Executive's Office, and Ann Birkland, Public Health, Seattle and King County's Government Relations Specialist. Shannon and Ann, please take it away.
Thank you, Andrea. Thank you, Lee. So I just want to start off to say thanks to everybody for being here today. I want to acknowledge that this last 18 months has been pretty terrible for everybody and really, really incredibly challenging, and especially so for many of our businesses, our recreation spaces, our entertainment spaces. And we appreciate that even with that incredible toll it has taken on employees and on businesses, we have seen King County as a whole and in all those spaces really step up to follow the science, to really help us in our work as policymakers and as public health experts to fight back against COVID-19. And we have some, really big success stories in that. And unfortunately, it's a pandemic and it has really thrown us for some loops as we've been following it. So I just want to acknowledge that, and that these partnerships with all of you have been really meaningful and impactful as we've been moving forward, and will continue to be so. So thanks for taking this time today. So we saw what we thought was going to be the light at the end of the tunnel as we were entering into summer, and then the Delta variant hit. So we are all hopeful it is peaking. I know we've heard a little bit about that in the news, but unfortunately, it is peaking here in King County at rates that are still too high. We are seeing really high infection rates, really high hospitalization rates, and more people dying from COVID-19. So my colleague Ann will be sharing more about that when we get to her presentation. But I just want to highlight that the goals of this vaccine verification program are really to slow the spread of the Delta variant and what might be around the corner, because as we know, these pandemics can be fickle and we need to be prepared. We can make our best guesses on data, but that's really what they are, is doing our best work with the science and with the data to move forward. And then our goal is to also keep our schools and our businesses open and operating at capacity. So we know the toll this has taken on our economy. We know the toll this has taken on businesses. We want businesses to stay open. And we believe adding this vaccine verification tool to our toolbox of things is one way to really make sure we can do that. We don't want to see lockdowns as we're moving forward through what we hope to be the final stage of the pandemic. I will also just highlight real quickly, I know that there are some people who probably question the merit of the order, and that is certainly a valid topic of discussion. But for today, that's not the topic for today. We really are here to try to provide some clarity around what is in the order and to answer questions about the order. If you have questions about the merit of it, I'm happy. I'll provide my contact information and you can reach out to me after the webinar. But for the sake of everybody's time, I would just highlight that. So a couple quick things before we get to Ann's slides. We are already aware of a few technical things we will be changing within the order based on stakeholder feedback and requests for clarity that we've been getting. One of those things is related to language in the order that calls out that verification will happen prior to entry. while that is a realistic operational thing for large events, we know that for some businesses, in particular some restaurants, it may make more sense to check vaccination when somebody is sitting down at a table to start drinking or have a meal or whatever the case may be. That totally is within the intent of the order, and we are going to clarify the language within the order to demonstrate that. So that's just one of them. Another piece is related to the acceptable mobile applications that could be used. The order calls out that a mobile application can be used if it's approved by Washington Department of Health or by King County Public Health. We're actually going to tweak that language to demonstrate that we'll have acceptable forms of verification. They'll be based on some parameters. We really appreciate some of the feedback we've gotten from some of the companies who are doing this kind of work in other jurisdictions. It's been very helpful. So we will have some updated language in that space as well. And then there's a few other technical tweaks, and who knows, based on some other feedback over the next couple of days, there could be a couple of tweaks as well. But substantively, what we'll share today really is the basics and the parameters of the order. There are also a few questions that have been coming in really consistently. So before we get started, I'm just going to talk about a couple of those. One is, does a vaccine verification violate HIPAA, or the Health Insurance Portability and Accountability Act? And the answer is no, it doesn't. So HIPAA only applies to entities in the healthcare field sharing private information amongst themselves. It does not apply to a situation where a business is asking a person directly about their vaccine status. And we can certainly share more information if that's needed for anybody around that. The other space is related to enforcement or fines or penalties. So as with other public health orders, King County, we are really focused on education and outreach to support people in following and coming into compliance with the health order. If we hear complaints about serious instances of patrons or businesses not following the order, we will contact businesses and event organizers and will take action as feasible. We are working now on how we will define and describe what escalated action could look like. I will hearken back to our early days of the pandemic where we had the mask orders, the social distance spaces. There were very few instances where we had to actually escalate to the point of doing some sort of shutting down a restaurant for a couple of days before they could come into compliance. Because really what we did was try to show up in that space, provide the education, make sure people knew what they needed to come into compliance, and give people the opportunity to do that. So I'll highlight that. And then, of course, as we've seen in the news sometimes, there are some cases where a person might refuse to show their proof of vaccination and decide to agitate in a space. And we know that is a really, really big concern for business, for some businesses in particular. So I would highlight that it's important to remember the vast majority actually of eligible residents in King County are indeed vaccinated. And for those, who refuse to show proof or appear to be agitating, we will indeed be working with all of our partners, our public health equity teams, and then using some examples from other jurisdictions about de-escalation techniques and things that we would recommend in that space. Safety is always the number one priority. If a business is making a due diligence effort to check vaccination status, we feel that business is in compliance with the order. We will not hold an individual business accountable to a person who refuses to comply. Those are two different spaces for us. So just want to highlight that. And then I know also some businesses have expressed concern that it's discriminatory on their behalf to ask for a vaccination status. They feel they're discriminated by doing that. Or on the other side of that the vaccine verification could be implemented inequitably amongst people going to the same business. Those are both spaces, again, that our public health equity teams and some of our other partners have been talking about. So we are also working in that space to provide more in a toolkit in partnership with the chamber. And in particular, we'll try to do some webinars and training around those spaces as well. So I just wanted to, sorry to take up so much oxygen. I just wanted to put a few of those things on the table right off the bat, and then I'll hand it over to my colleague, Anne, who's on mute.
You would think after 17 months of this, we'd get used to it, but alas, no. Good afternoon, everyone. I'm Anne Berkland. I lead state and local affairs for Public Health Seattle and King County. Thanks for taking the time to be here. Just to put a finer point on what Shannon said, while we are starting to perhaps see a plateau or a small decrease in our COVID rates, we are well within high community transmission as defined by the CDC. Our latest data is showing that we are averaging 500 cases each day. This is similar to incidence rates that we've seen in other peaks of the pandemic. And sadly, over the last 2 weeks, there have been 54 deaths reported. Additionally, hospitals in King County, as I'm sure that you've seen in the news and across the state, are at their highest occupancy rates and their fullest point since the pandemic began. This is really because of a combination of staff shortages. Our healthcare workers are incredibly burnt out. We also have people who have been putting off their procedures because of the pandemic and they no longer can wait, and because of our high COVID transmission. So those three things are overrunning our healthcare system in the state right now. As you guys know, this is a risk to all of us, not just COVID patients. And so that's why Dr. Duchin is looking at what additional tools we have in our toolbox to spread or to slow the spread of the disease as we go into fall and winter. And as we have students return to school, the vast majority of whom are not eligible for the vaccine yet. One last thing I want to say on that before I move to our vaccination rates is just that when Dr. Duchin was looking at this order, he did ask UW to do some modeling, and that modeling came back with projections that the outbreak is going to worsen within the next 6 months unless we take additional action. Now, we would be in considerably worse shape if it were not for our region's high vaccination rates, which we have everyone in the region to thank for where we're at. We really came together and worked on this together. So 68% of King County's total population has been vaccinated, with 79% of the total population having begun the vaccination series. Of those who are eligible for the vaccine, you guys will know that's the folks that are 12 and over, 79% have been fully vaccinated and 86% have started their series. However, there are nearly 600,000 King County residents who have not yet got their vaccine. About 300,000 of those are kiddos, 2 of which are mine, who are not eligible. And there are 287,000 folks who are eligible but have not yet started the series. And that large of a group really is enough to sustain a very long and damaging Delta surge. So with that, I'm going to run through the local health order. We're going to keep it pretty high level because, as Shannon said, we're here to be of service to you and to answer questions. So we're going to give you the outline and then really want to spend the bulk of our time addressing what questions you have. So give me a moment to share my screen. Great. So what are we talking about here? Beginning October 25th, customers will be required to show proof of COVID-19 vaccination or a negative test to enter outdoor events with 500 people or more, indoor recreational events or establishments, so professional and collegiate sports, entertainment, performing arts, gyms, theaters, live music, conferences, restaurants and bars with capacity over 12. This does not apply to your outdoor dining or your takeout. It also doesn't apply to places that are not primarily used as a restaurant. So again, examples of what we're talking about here are professional and collegiate sports, a music show, a theater show, a convention, restaurants and bars, gyms. Those are just examples. Beginning December 6th, customers will be required to show proof of COVID-19 vaccination or a negative test to enter restaurants and bars with seating capacity of 12 or less. This longer runway was put in place to respond to stakeholder feedback that some of our smaller businesses really needed a bit more time and a bit more support to implement this new LHO. This new LHO does not apply to our kiddos who were under the age of 12, since they're not eligible for vaccine, to vote centers, so places that people are voting. It does not apply to your employees or volunteers at events and establishments, because that is governed already by L&I. It does not apply to outdoor or indoor youth sporting events, their participants or their spectators. Again, it does not apply to outdoor dining and takeout from restaurants, taverns, and bars. Nor does it apply to indoor dining in buildings that primarily serve for non-dining purposes. So like the food court in your office building, airports, the grocery store, like we mentioned, this does not apply to that. And finally, it does not apply to funerals, faith-based gatherings, or weddings. I'm going to turn it to Shannon for the next couple of slides.
Thanks, Anne. So this is a little of that space I mentioned related to mobile apps. So what is considered proof of vaccination? We're trying to be as flexible as we can in this space. And so a CDC card, your actual card from your vaccination, or a photo of your card on your phone, documentation from a medical record or a vaccine provider is acceptable. Proof of vaccination from another state or country. And so we're working on trying to provide some examples of what those will look like. Mobile applications, and so Clear is one example that I know folks have used in some other settings, and there are a handful of other apps in that same space. So we'll be sharing more out about that as we hone in on that space. And then a printed certificate or a QR code, and this is the My IR Mobile, is being set up by the state. And so we are eager to have this in place. It's supposed to be in place by the end of this month. And so that also will be an eligible proof of vaccination. People do not need to show identification along with their vaccination proof. We had a whole lot of feedback from stakeholders that this is, as far as equity issues and trauma to folks in some other spaces, it just was not a viable place for us to go. So we just wanted to take that off the table and cause hopefully less stress for those checking vaccines as well as those needing to provide them. So that's kind of the array of proof of vaccination pieces that are eligible. And then Anne, I don't know if you want to cover this one or if I've got it. Okay. If you are unvaccinated or you cannot prove vaccination status, or, and this falls into the space, if you have a medical exemption or something like that, having staff check, medical exemption letters from doctors did not seem feasible. So the options are to show proof of a negative PCR COVID-19 test from within the last 72 hours, or a negative rapid test from an on-site testing provider. This really is more realistic for some very large events where they sometimes bring in a testing provider and they can do FDA approved rapid testing that a provider brings, a provider is at the event and does those tests. So what does not count is an off the shelf home rapid test. You can't just like bring in the stick and show your stick as a negative test. So those are the two spaces for the testing out options.
And we'll be covering a lot of your questions, I'm sure, today, but there is a King County website, kingcounty.gov/verify, that has FAQs. And we're also partnering with the chamber to create additional resources for everyone. And with that, I'm going to stop sharing. And I think, Andrea, we can open up for questions.
Fantastic. Thank you. I appreciate that so much. And I really appreciate everybody continuing to put their questions into that Q&A feature. Again, that just helps us manage and make sure that we are getting to all your questions, because sometimes things can be lost in the chat. So first question, there's several questions in the Q&A kind of centered around the employee piece, right? So could you talk a little bit more about if this covers employees, why or why not, and why would there be a mandate for customers and not employees?
Want me to take that one, Anne? Okay, so first I do want to clarify that in the order, it is strongly recommended by the health officer, Dr. Duchin felt strongly about this, that employers and event organizers should require, or are recommended to require vaccination for workers and volunteers covered by this order. The reason they are not, there are a couple of different reasons. One is that it is covered under Washington State, under the Occupational Health and Safety Administration regulations and Washington State L&I regulations. Employers are covered through some COVID safety things, which does not necessarily specifically include vaccine verification, but with the Biden order that has just also come out, we haven't seen all of the pieces of that and the complexities of combining our order at a local jurisdictional level with what is happening with the federal order, and then meshing it with these other regulations that were in there seemed to be that we were worried that that would not provide enough clarity and create a lot of challenges there. So that is the reasoning for it. Nothing in the order, of course, precludes a business from requiring their employees to be vaccinated. That isn't, a business can certainly do that. But for us, that is not a part of the order, but rather a strong recommendation from the public health officer.
Perfect. Thank you so much. And confirming the federal order from the Biden administration, that's for businesses with 100 employees or more, correct?
That's correct. Yeah.
Thank you. A couple of questions in here also. Again, vaccine rates, do vary, by community to community, and King County is a large jurisdiction. Some businesses are anticipating, based on vaccination rates, that they may lose up to 30% of the business that they currently have now, which is also substantially down from what it was in 2019. And are worried about that continued loss of revenue. Will there be programs similar to the PPP, the SBA, the Working Washington grants, those types of funding and support programs that businesses that are impacted by this can apply for?
Thank you, Andrea. So we are working, yes, to create some opportunities and programs potentially for some grants to help mitigate in some of those spaces. We don't have anything in place yet. We're working in partnership with the city of Seattle, with the chambers to kind of work and determine what that might look like. And our primary consideration is to just make sure we're also getting resources and public education out there so that businesses can manage it in a way that won't be hopefully too impactful, and that we can also help to educate the public to understand why those things are in place, and frankly, encourage people to go places with the understanding that the vaccination rates will actually make those locations safer for them and for their families.
And I would just add, King County Public Health, we are still really doubling down on our efforts to get, while you see a lot of news about booster shots, we are doubling down on our efforts to continue to close those geographic gaps for first doses in King. So I hope that we see those numbers continue to rise.
Perfect. Thank you. Next question, kind of centering around venues and events. As far as the order goes, where does that responsibility lie for the vaccine verification? On the venue itself, on the service providers, contractors that might be, at the event, the event planners for the people hosting the event, kind of where does that live?
Thanks, Andrea. So frankly, from our perspective, it can kind of be up to the venue to determine where that lies. In many spaces, we think it does make sense to have that lie on the contractor who is using that space potentially. But we think that should be under sort of the prerogative and with the operational knowledge of the venue itself. If folks have particular feedback on that, we're certainly interested in that, but we feel that the venue could make that determination. So the venue could, in a contract, for example, as they're having an event come on, say, it is your responsibility to check vaccine verification for everyone attending this event.
Thank you. For private events and things, less than 90 guests, how does the vaccine mandate work with that? Would that be the same type of situation where there would be a contract with the event venue and the event host?
Yes.
Thank you for confirming that. Any guidance on multi-day events, for example, a convention or a conference that might extend, 3 to 5 days? Would the event host need to be doing, tests every day, PCR tests a couple times during the event? How or what would that look like?
That's a great question, one that we actually just started getting today. So I don't think, unless Anne has an update, we have an answer to that one yet, except that I will say, I don't see a space where an everyday testing thing would necessarily be required. I mean, unless it was, it's just hard to see where that would be the case, but it may need to be more than just the initial start of the event. So we are talking with Dr. Duchin and trying to make that determination.
Perfect, thank you. I know this has come up before in our conversations, Shannon, but the idea of whether or not this will have a similar roadmap to the roadmap to recovery. So we had our phases and we knew when the infection rates were this much, we had to do this. And when they were this much, we had to do this. Does this plan currently have that same model? Do we know when infection rates go down, we won't be doing this anymore? Any type of information on that?
So appreciate that. So the order does indeed talk about that within 6 months or sooner, we will reassess the need for the order. So we don't have, I know everybody would love to see like a specific trigger, like when the number gets to here, we're good. Given the dynamics of the variant and the dynamics of new people becoming eligible, kids, for example, becoming eligible for the vaccine, seeing what happens with schools and what outbreaks in schools may or may not be, we don't have a specific trigger. And we will be assessing very consistently, as we always do with our, I don't know if everybody has seen our dashboards on the King County Public Health website. They're really, really impressive, actually, that show the rates and where we are. If we start seeing a consistent rates going down in infections, rates going down in hospitalizations, and Dr. Duchin and his teams are feeling like, hey, we're getting into a much safer zone, we will absolutely reassess the need for this order. This order is not considered to be permanent.
Thank you. A couple questions about gyms. So when we say gyms, do swimming pools indoor count as gyms or workout facilities? And similar with, basketball courts, right? Is a basketball court, also count as a gym? Does a pool count as a gym?
We just had the same conversation with Dr. Duchin yesterday, and his guidance was to think if it matters what kind of building it's housed in. So if you're at the swimming pool in your condo, no, it doesn't. But if you're at a swimming pool at the 24-hour fitness, yes, it does. So is the building primarily used for recreational functions? Then yes, this does apply.
With like public access. So
yes.
Right.
And that would be same for the basketball court idea, right? As long as if it's publicly available, then yes. If it's a private facility, then no.
I wouldn't go that far. I would say more, what is the facility that it's in?
Okay.
Yeah.
Perfect. Thank you.
And indoors.
Indoors.
Perfect. Great. Thank you. This is a question from the city of Auburn, my hometown. Go Auburn Trojans. Several outdoor events coming up. Of course, the largest and one of the most popular is the Veterans Day Parade. There will be more than 500 people there, but they will be spread out. How or what would that process be?
So that's another great one that we've been sort of discussing. And I believe, though it is not finalized, we have landed on parades would not be included in this vaccine verification. The realities of the points of entry, the spacing, the moving of the people through the parade, we think make both the implementation pretty challenging and also just the realities of those spaces just probably will not be a part of the verification. Did I miss anything there?
The only thing I would say is just thinking about layering on protection. And so those attendees at your parade should be masked. With Delta, we are seeing transmission outdoors, which we had not seen before.
Great, thank you. Question about cosmetology, barber services, spa, skincare, beauty industry, self-care, addressed in any of these mandates? Okay.
No, none of those are covered under the order.
Another question about museums, art galleries. Are they also included in the order? They are. Thank you for confirming. This is a question I think related to the COVID testing, and just to confirm that the COVID test must be either the rapid test on site or it needs to be the PCR test within that 72-hour window. And that's the time frame that is acceptable.
Yeah, and the rapid test, like Shannon said, is not getting a Binex now and taking it. It's that it has to be done by a provider at the location of the event.
Perfect. Great. Thank you. Follow-up question to that. Are all outdoor events with less than 500 people, acceptable as for personal events? So as a personal private event, is that something that is covered with the mandate in terms of private events over this or private events over that? If it's a private event, it's a private event.
As long as it's not in a venue that is covered by this. So it could be considered a private event if you like rent the space in a hotel, big conference room, that would be covered.
Right, understand. Perfect. Just a general question that maybe you could shed a little bit more light on. You talked about it a little bit, Shannon. Again, all businesses are struggling now, not just, businesses with, 12 seats, or less. Can you talk a little bit about, why there's that difference between the October 25th and the December 6th? Again, everybody has reduced sales and impacts.
Yeah, I appreciate that. And I'll actually let Ann take this one a little bit as well, because this came a lot from our stakeholder outreach as we were. I will tell you the reason 12 is chosen is because that is actually the business license number for
the food permit. Yeah.
And so that was really where that number came from. And then based on that stakeholder input, we decided to give that little bit longer runway. We are also emphasizing, we recommend that everybody implement as soon as possible. And so we will be doing outreach even to those under 12 capacity spaces to really recommend as soon as they are, as soon as they are able to implement, that they do. It's not we're not encouraging people to wait that long. It's just, we understand the realities of the implementation for some of these spaces. So for example, we were able to get a lot of people on this call. I think we've done a really good job with a lot of outreach, and still we know there are going to be gaps in who we're able to reach out to and how long it's going to take us to make sure they have all of the information they need. But Ann, did you have anything else to add?
No, it was just very clear that a lot of our smaller venues will need more support, whether that's resources or, just understanding the regulation or language translation. And Dr. Duchin wanted to be responsive to that.
Fantastic. Thank you so much. Next question about municipal recreation, community centers, youth centers. Does it apply to all of those centers?
That is one that we are in discussion with Dr. Duchin on. So we would like your feedback. It's so that will be one Shannon mentioned at the beginning of this, that these conversations are helping to bring the need for a bit more clarity. And so if this is a community center that's asking the question, we would love to talk with you. So maybe you could get in touch with the chamber and then connect with us, because that is something we're trying to sort out. Because like a gym at a community center is a high risk activity. Any aerobic activity where people are, emitting aerosols. Senior centers is under this case where that's a really high risk group, but we also don't want to interfere with people getting their essential needs met. And so we are under discussions, and we'd love some feedback on that.
Perfect. And again, similar to that youth sport question, oftentimes, schools will rent out a facility, for a different event or activity, performing arts center, perhaps on campus, et cetera. would, or even a religious service. Sometimes churches, will be, renting facilities on school property. Would the vaccine verification apply in that instance as well?
It does, except for religious services are exempt, but highly recommended to participate. Yeah, but if it's not a school-based event, it does apply.
Great, thank you. And appreciate everybody's patience as we're getting through. We're over 100 questions right now. And I know, we've got, 19 minutes left, and we're doing our best to get through them as quickly as possible. It's possible you might not get to all the questions, and then we'll be sure to put the contact information so we can get feedback back to the people that need it. A question about other counties, other jurisdictions also moving to follow the same guideline. Who else is moving this direction?
Shannon, I know Clallam and Jefferson did it on the peninsula. I believe there is one more in Washington State that's escaping me. New York did it. LA did it. Am I missing anyone?
San Francisco, but for local, we have heard that conversations are happening. Other jurisdictions are indeed discussing whether or not they want to implement this kind of policy, but I can't speak to where they are in that discussion.
Thank you. When you were talking about the Biden and the federal order, there was also an L&I order that you mentioned. Shannon, could you just elaborate a little bit more on what the specifics are with that?
And to be clear, I don't know that it's an order, but it is regulations that are in place through labor and industries at the state level for employees in different spaces. We can certainly we can dig up that link and share it with folks here, or have you all share it on our behalf with folks here.
Perfect. So just again, a point of clarification, conventions that have 450 people would not be required to show proof of vaccination.
That is not accurate. If it is outdoor, but if it's indoor, any indoor activity, regardless of size. Perfect.
Any indoor activity. Perfect. Thank you. And again, private event, indoor activity would still need to show the proof of vaccination depending on the venue. So if someone is planning to host an in-person event, what they should be doing right now is checking with that venue. And then as a venue who they're planning on doing these events, they need to be looking at how maybe they would be adjusting their contracts or their event service orders to accommodate for that.
Yeah, that's great, Andrea. And for folks who are on this call, and we are going to be doing some more outreach in this space, again, if you're in any of those spaces and you have some feedback about how anything we can do can help to assist in some of that clarity around that, please reach out to us. We're very interested in that feedback as well.
Great. This is a question that I know has come up quite a bit with our membership, is that there's so many businesses that kind of have a mix of like, well, we're kind of this and we're kind of that. So what about a hotel that is primarily a hotel, but they have, maybe a small bistro or bar, again, not primarily a restaurant, would that still be something that would be necessary for them to try to accommodate?
I think the bar and restaurant would need to accommodate. They have a food permit, they're licensed to do that. Where that's a little bit different is like we talked about, like the gym in the hotel. This doesn't apply to that, but I think restaurants really, unless it's like a food court situation and mostly grab and go, this applies.
Yeah, one way to think about it is if there's designated seating for the restaurant in that space, it is probably under this order. If you feel that you're in a space that you're like, I don't think we are, by all means, we're happy to talk with you about that. We can't individually check off every space, obviously, but we understand that there are some kind of these funky spaces that exist. But for example, at the convention center, you walk in the doors of the convention center, there could be any number of food establishments around the edges, and there is undesignated seating, right? There's just general seating in the lobby. Those are not under this order because that is not a designated seating for a specific restaurant. If you go to a restaurant, I like Duke's at South Center sometimes, and if I go there, it's at a mall, but it's not a part of the food court. It's a designated restaurant space, so it is under this order.
Great, thanks for clarifying. Question about just verification without ID being required. How can that be, verified to be that person's ID, or are there programs or procedures outlined, for recognizing what could be, forged documents and those types of things?
So it's against federal law to forge a vaccine card. So that is something folks should be aware of. We would certainly ask that if a business starts to feel like, hey, we're seeing some consistent looking things that seem fake, we're wondering about that. We would love to hear about that so that we can start to make sure there's not some big, broad industry behind the scenes creating fake vaccine verifications. And at the same time, as most things have been throughout this pandemic related to our public health orders, it's a pretty trust-based space. And, we're trusting our communities and our businesses to uphold the order to the best of their abilities and to the appropriate intent. And so we, if and this will be part of the training, like so folks can see what counts, what doesn't. But I would say to err on the side of your, judgment. It'll be a judgment call in many cases for many of these businesses, but we don't want somebody to get into a fight with somebody about whether their vaccine card is real or fake. And if people feel like they're starting to see a pattern of something fake, we would certainly want to know about it so we could let authorities know so that they could start to look into that situation.
Thank you, appreciate that. Clarification, again, children 12 and under this does not apply to them. But other, youth activities happening indoors, such as a youth theater performance, youth band, for, children over that, this would apply. Correct?
Yeah, unless it's a school-based activity, and we are going to amend the order to ensure that there's clarity on that. If it's a school-based activity, does not apply because schools are already similar to LNI regulations for employees. Schools are being guided by a different set of regulations, the DOH school guidance.
And bed and breakfast establishments, no. Talk a little bit about testing. So the rapid, PCR tests, making testing more accessible. Will King County be working to lift up more testing sites and make more testing accessible?
We are working to try to build our capacity at our testing sites. Again, as we thought we were seeing the light at the end of this tunnel at the beginning of summer, we started kind of, backing down on a few of those spaces because frankly, we weren't seeing the need as much. And so, yes, we are working on that. And the city of Seattle is working on that as well. So we're working in partnership in all of those spaces to try to see how we can build that capacity.
Fantastic. Question about if it will be applicable to 501c7 organizations.
And I don't know what a 501c7 is, so.
I don't either.
So
maybe you
put that in the questions. We'll follow up.
Perfect. And you did clarify not religious organizations. So if it was a religious service, it does not apply.
That is correct.
Perfect.
But on behalf of Dr. Duchin, I always feel the need to say he would encourage everyone to do it, even if it doesn't apply.
Perfect. I think this is a good clarifying question too. Again, so many of our small businesses have done a lot of infrastructure improvements to improve sanitation, improve ventilation, and everything is spaced out well. But other, for example, retailers that may not be doing those things are exempt from this and are not required to check the customer's vaccination status. Can you talk a little bit about how you came up with these businesses? Yes, these businesses no?
Yeah, I'm happy to do that. So we know that COVID is spread easily through the air. So when people are emitting aerosols, when they're unmasked, doing things like talking, yelling, singing, aerobic activity. It is a higher risk when you're with people from outside your household, so sitting down at a table with people who don't live with you. And it is an even higher risk if it's a long time together. So that's kind of what you see in the order. For example, Andrea, you talked about a grocery store. People are going in, they're masked, they're not sitting down with people. They're grabbing their groceries and going. That's a lower risk activity than going to a crowded space, eating, drinking, dancing, listening to music, whatever it is. And so that's what you see reflected in the order.
Perfect. Thank you. Question about employees with a medical exemption. Do they need to get tested before every shift? I think those are things that, like you were saying, Shannon, would be covered by L&I or OSHA, not with this particular mandate. This particular mandate has to do with customers and people coming in, not with employees.
Correct.
Perfect. A question about what the county has seen in terms of BIPOC communities and minorities. We know that vaccine access has been more of a challenge for groups of BIPOC community members. How and what are we doing to create more access and to be more equitable as we roll this out?
Do you want me to take vaccine, Shannon, and you take the other half? Yeah. So actually, just a couple of weeks ago, we passed the threshold that across all race and ethnicities in King County, at least 70% of those race and ethnicities who are eligible have started the vaccine series. Throughout the entire vaccination process, we've seen not a huge drop off of people who don't complete the series. So we have led with equity this entire time with vaccines. The first vaccination high volume sites that King County stood up were in South County, where we were seeing the greatest COVID rates. And so that was the first thing we did. The next thing we did is we've literally paid community partners to go out and be trusted messengers and to provide vaccination at trusted community partners and churches with trusted messengers from community. That work continues as we close the gap. We've scaled back the high volume sites throughout the county. We're turning them back on for boosters, but we are continuing to double down really on our place-based approaches of diving into the communities with the lowest vaccination rates. And we have a long way to go, but we are in much better shape than the majority of the country, as witnessed by that 70% threshold across all races and ethnicities. I would also say we are also one of the only jurisdictions that tracks that data. And so we have a better idea of where we are compared to most other jurisdictions in the country.
Thank you, appreciate that. Lots of questions popping up just about expressing frustration that they followed all the rules, but sometimes their competitors maybe didn't follow all the rules. So they take the brunt of the less business and the hardship by following the rules, but others don't. And there was not a lot of follow through in terms of penalties and punishment for those that did not follow through. Could you talk a little bit just about what the process is, for, as you mentioned, Shannon, focusing on education and outreach, but what other support is going to be available for businesses who are trying to do the right thing, but quite frankly, just feel like they're being penalized for it?
Well, I'm sorry. I mean, I both get it, and I'm sorry that people are feeling that way. And I will say, I do think there are spaces where people are looking for the businesses that are doing the right thing and are not going into, I know early on in the pandemic, I did not choose to go into some spaces where it was clear they were not following social distance rules, for example. So my family and I would make a different choice and take our money to a location that was. So I'm hoping that people are seeing some of that as well. We are definitely going to be, as I said, working to try to get some resources, tools, and a really good understanding of what it is that businesses like the ones you're talking about that really want to comply and be in compliance and work to keep our communities safe, that we have the tools and resources to them. So we're working closely with community, with all the folks hosting this call today to do that work. And as I said, if we are seeing egregious non-compliance, there will be follow-up to egregious non-compliance, just as there was during the masking and social distancing days earlier on in the pandemic.
Great, thank you. We now know what a 501c7 organization is. It is a private members only club. If it's an indoor private members only club, would that also apply?
This one came up, and I believe that we came down to yes, because often like a golf club, for example, or a country club is private and indoors and is a restaurant basically. So with designated seating. So I believe the answer to that is yes, in that space that is the indoor dining space.
Perfect. I appreciate that. Going through the questions, there's definitely a lot of duplicates I'm trying to go over. Again, it's continued questions and concerns just about, the discrimination and, what can we do to ensure that this is equitable and that, people don't start to feel like they are, second class citizens. Do you have any advice or feedback for businesses who are struggling with that?
Again, I would say, first of all, we any of those connections to folks. So if you, for example, Andrea, or anyone else from the organizations on this call are hearing from those businesses, we would also like to hear from those businesses. We have, as Anne mentioned, pretty strong community navigator type outreach to folks that are really trying to help make sure there are trusted messengers in those spaces to provide information and resources. And I'm sorry, my neighbors are having yard work done apparently. So we absolutely will be doing what we can to mitigate in those spaces. Our equitable outcomes have been far and away a big goal of our public health teams and our policymakers. And I think while there's always room for improvement there, that I'm pretty proud of the work we've been able to do. And we're going to really try to continue doing that in this space as well.
Thank you. And I think we probably have time for maybe 2 or 3 more questions. And again, we're not going to get to all of them. So we will do our best post-event to get the answers to these questions. Question about an outdoor 5K run. Would people need to wear a mask when they're running? Would they just need to check proof of vaccination? What would a good protocol be for that?
If they're currently supposed to be masked, which I would want to re-look at the masking order, but we can send that out. This does not change that because this is just an added level of protection, but I don't know what the order would be for that situation related to the mask, so we can send that out for a review.
Thank you. And again, just clarifying that when we talk about venues and hotels, we're talking about if a hotel has meeting space, then yes. If a hotel does not have meeting space, then no. Correct?
Yeah, lodging is not covered under this order. So if it's lodging, not covered under this order. If there is a restaurant attached to the hotel, that would be covered under this order. If the hotel has conference rooms and is hosting like conferences, convention style things, that would be under this order. But the portions of the hotel related to lodging are not.
Perfect. Question, just asking, it would be really helpful to have more public education for the general public, urging compliance, patients, supportive local businesses who are following and following the order, some type of shop local safe initiative and messaging. Is there a public awareness communication plan or strategy in the works?
Absolutely, there is. We've been working on it. We're also working on some good signage for those restaurants. The general public education through social media, through our partnerships, that is a space we feel is really, really important. And absolutely, we are engaging.
Fantastic. Really appreciate that. And then again, we'll just get one more, question in here. What about events like wine walks, where people are outside, they come inside, but as you mentioned, it's kind of transitory. They're not in a space for a long period of time. Would someone who's buying a ticket to a wine walk need to be vaccine verified, or because it's mostly outdoors and inside at retail shops, not necessary?
If it's someone who's taking off their mask to drink a sip of wine inside of that winery, they need to be checked. It would be up to the event if they want to check prior to people starting the event, or if they want the businesses to be checking.
But if they're doing it like it's takeout and they legit get their wine and they legit walk outside and they're drinking and wine walking, it would not be covered. So I think that's a space where, for example, whoever's organizing that could create it in a way that could make sure that they either didn't need that vaccine verification or may just choose to require it for ease of managing folks who are there.
Great, thank you. Again, still 66 questions in the Q&A, not going to get to them. We are at time, but we will do everything that we can just to help answer the questions and help everybody navigate this space. We know how difficult and challenging it is for all of our businesses and everyone in our community. So thank you so much to our speakers, of course, to Seattle Metro Chamber for hosting One Eastside Spark, Business Health Trust, and of course, King County. Please, stay healthy, stay safe, and do reach out to us with your questions and concerns. We are here to help.
Thank you.
Hi, and sorry, this is Lee again. I just wanted to let everyone know that I am copying all of the questions from the Q&A box. So anything that was unanswered, we'll sort out the duplicates and send those over to our friends at King County, hopefully to try and get some answers to you all in my post-event email. So thank you.